I'm Kathleen Brennan. I'm a GP and I work in Forth Valley. Whooping cough is a highly contagious bacterial infection that can cause severe bouts of coughing and can be particularly problematic when children catch it. Treatment for whooping cough is antibiotics, but the other symptoms that go along with the whooping cough can be alleviated by simple self-care measures. So taking paracetamol to help alleviate any fever, ensuring you rest and are well hydrated and drinking plenty of fluids, making sure that if that cough is producing any mucus or you vomit after the cough, that you're clearing that away and making sure the airways are clear. The severity of the bouts of coughing and whooping cough are different to just a normal cough, and they can cause people to be very unwell when they're having these bouts of coughing, and they can cause people to have difficulty breathing at times. So antibiotics are the treatment for whooping cough, and they will treat the bacteria that causes the infection. When people have whooping cough, it's important that they isolate either until they've been on antibiotics for 2 full days or until 3 weeks after the coughing has begun. So if people don't receive antibiotics for their whooping cough, after that 3-week period, they don't need to isolate any. When people have respiratory infections, sometimes they can have difficulty breathing. So if somebody has difficulty breathing, difficulty catching a breath, difficulty getting a breath, then it's important that they seek medical attention immediately. If the fever that they have is not coming down, or they're feeling worse rather than better over the period of their illness, then they should be seeking medical